Hey everybody, today we're going to discuss about nephrotic syndrome. What is nephrotic syndrome? Okay, so there are 4 clinical features related to nephrotic syndrome. First, there is proteinuria. Proteinuria which is more than 3.5 grams per day. Whoa, that's a lot. But why the edema? So the protein, which is albumin, is lost, which leads to a decrease in oncotic pressure, causing edema. We also see hypogammaglobulinemia. This leads to increased chances of you getting an infection. Hyperlipidemia and hypercholesterolemia also follow because cholesterol is shot off into the bloodstream. Now, let's take a look at this diagram. It has about 4 components. So the first component is the endothelium, which is in pink. Then we have the basement membrane, which is in red, and then we see the podocyte, which is in yellow. But all these 3 structures are glued together by a blue stuff called the mesangium. It holds the 3 layers together. So let's move on and discuss the types of nephrotic syndrome. In the first type, which is called minimal change disease, we see everything is fine except the podocytes. The podocytes are effaced. Oh, so what else? It's also associated with Hodgkin's lymphoma. Hodgkin's lymphoma causes an increased level of cytokines, and this causes effacement and inflammation. And how do we treat it? We give steroids, which is the main high yield point about this, because it's an inflammation due to the cytokines. The second type is focal segmental glomerulosclerosis. What do we see in this? Well, we know for sure that focal means a local area that is involved, and the area of the glomerulus is sclerosed. So now this is similar to minimal change disease, but there's focal or local involvement of the part or the segment of the podocytes which are effaced. And in this case, if we give steroids to the patients, we will see no response. It is primarily a segmental narrowing, means only one segment is sclerosed. It's associated with HIV, hepatitis B and C, and sickle cell disease. Let's move on to membranous nephropathy. As you can see in this diagram, there are immune complexes that are deposited in the subepithelial zone. That's why they're called subepithelial deposits. This shows a spike and dome narrowing. Let's move on to the content. So immune complex deposition and thickness of the membranes, which is what results in membranous nephropathy. Immune complex gets deposited in the subepithelial zones, which is very, very high yield. As you can see, the V shape on stripes in between the domes is called the spike. That's a characteristic term for membranous glomerulonephritis. And this spike and dome appearance is commonly seen in patients with SLE. Now we move on to membranoproliferative glomerulonephritis. Membranoproliferative has 2 key terms which tells you the diagnosis already. Membranous means that it'll be similar to membranous nephropathy, like we've seen before. And also proliferative means the mesangial cells proliferate. When these cells proliferate, they divide the basement membrane layer into 2, and there will be 2 different types of deposits that you will particularly see. First will be the subendothelial deposits, or below the endothelium, and the other one will be the basement membrane or subepithelial deposits. And this characteristic finding is known as a tram track appearance. This is very, very high yield to know about in membranoproliferative glomerulonephritis. Now, an important point in MPGN is the different types of MPGN. Type 1 is associated with subendothelial deposits and is seen in patients with hepatitis B and C. Type 2 is also known as dense deposition disease, where there's immune complex deposits which are located within the basement membrane. And this, what a particularly important point to know why the complement level C3 goes down, is because there is an antibody, C3 nephritic factor, which stabilizes the C3 convertase, resulting in overactivation of the complement. This overactivation decreases the number of C3 components. This is associated with nephrotic, nephritic, or even both. Now we'll talk about diabetes mellitus. Diabetes mellitus is an endocrinological disorder of glucose metabolism. This leads to increased glucose because of either increased insulin resistance, downregulation of the insulin receptors, which ultimately causes a major problem in the kidneys. Why? Because there's non-enzymatic glycation of the vascular basement membrane in the glomerulus. This leads to increase in the proteins in the vessel walls, resulting in a key term that we need to know: hyaline arteriolosclerosis. Hyaline arteriolosclerosis develops when there's a particular efferent arteriole and there's an afferent arteriole. Efferent arteriole is where this most commonly occurs. Due to the narrow lumen, which eventually develops due to arteriolosclerosis, there is increase in the back pressure in the glomerulus. This increased back pressure causes increase in filtration pressures, which is also a key term known as hyperfiltration that we need to know. And hyperfiltration causes increased glomerular filtration rate, eventually causing sclerosis, thickening of the mesangium, that thereby leading to nephrotic syndrome. The treatment that we need to give for this is ACE inhibitors. ACE inhibitors help slow the progression of nephrotic syndrome and diabetes. In fact, any patient with diabetes and hypertension, we need to start ACE inhibitors. Angiotensin II is another key modulator that causes vasoconstriction of the efferent arteriole. When we give ACE inhibitors, we cause vasodilation, thereby decreasing the hyperfiltration in the kidney and reversing nephrotic syndrome. So, in the end, nephrotic syndrome related diabetes causes small little proteins called microalbuminuria, and this is very, very important because this microalbuminuria leads to sclerosis of the mesangium, causing particular nodules that are high yield, Kimmelstein-Wilson nodules. Amyloidosis is very, very common in the kidneys. It's an extra protein that deposits everywhere across the blood vessels in many different spots around the body and usually occurs as we age. Kidney is one of the most common sites, and when the amyloid deposits in the mesangium, it leads to nephrotic syndrome. You will see apple birefringence under polarized light, and this is particularly high yield. Okay, I hope you all liked our series of nephrotic syndrome, and please like, subscribe, and comment if you want anything changed or if you want any new particular topics regarding the kidney, and let us know. Thank you.